you got this information. So when you have something to study, please cut it up in small little pieces and make sure that you are going to tackle them little by little. Like I'm just showing you the picture again. You are going to just understand what you're going to study and telling yourself, I'm just gonna need maybe an hour because I have about 7 different little topics. And sometimes you feel like, oh, there was one more page of like common side effects. Oh, and I forgot the quizzes. So just like that, you're looking all of that and you are telling yourself, I wanna cut this up into smaller little pieces. Now you have that. And sometimes I want you to see the images. What those are, they're actually anchors. You know, when you're driving, okay, I thought I was a great driver, but people tell me I'm not a great driver. So don't let me drive, okay? But good drivers or taxi driver, what they have is they have anchors. For example, they're like, oh, in that corner, there's a pizza place. In the next stoplight, there is McDonald's, for example. So that's what they do. They have anchors. So you're trying to find some anchors here as well in what you're studying. That could be a picture. Okay, those are great anchors. So you're just, again, scanning the whole thing. You're trying to be a detective saying, what am I seeing here? And then sometimes if you find words, anchor words that you know, your brain starts to think, okay, it's not that bad because I know this word. It's like when you are given something that you do not want to eat, you never tasted in your life. Do you want to just start eating it right away, or you're a little skeptic of like, should I do it or not? Frog-like, should I try it or not? Right? There's a pause. So if you don't give your brain something that it can recognize, there's going to be a pause, and there's going to be resistance, and you don't want that. So find some words that you know, make yourself feel comfortable and better. And then you're going to estimate your time and then chunk it. So this goes into the next trick that I'm going to teach you. So the first part is seeing the big picture of what you're doing. You got this? Let's continue. The next part is, I said, chunking. Okay, so another word for that is Pomodoro technique. If you actually Google Pomodoro technique, this has helped millions of people in the entire world, and I still use it to this day. Anybody heard about this? You can say yes or no in the chat. I'm just curious if you ever heard about it. We have a lot of no's. All right, thank you for being honest, everybody here. We have Arliss, Laura, Marwa, Gina, Marby. Okay, do you know what Pomodoro means actually here? Charlotte, you have. Oh my God. If you have, you can let me know where you heard it from or what it means to you. Pomodoro, anybody knows what that word means? Tomato, perfect. I think it's a type of tomato. I'm really not versed in my tomatoes, but it's a tomato technique. It came from the word when you have, I think in the kitchen they have those kitchen like timers, and sometimes they're shipping tomatoes. I think that's where it came from. Charlotte University Study Prep. That is fantastic. I need to talk to you. I really love that school. Can you tell me which school you're going to? So what it is here is tomato technique is 25 minutes of concentration, 5 minutes of break, 25 minutes of concentration, and 5 minutes of break. What you are doing is chunking, is again, making everything digestible, just like your food. That's why in the very beginning, I told you, while studying is just like eating, okay? I mean, are you happy already? Studying is like eating. Who doesn't like eating, right? So 25 minutes and 5 minutes, that is the cycle. 25 minutes of, you know what I do actually? I turn off my phone when I really need to focus, or actually put it in my drawer. So you're gonna do that. When you have 5 minutes, you can go get your coffee, you can go your tea, you can go on Instagram, you can start chatting with your friend, but come back strong, 25 minutes, and then break 5 minutes. So it is really being able to just give you some time to focus, and also some time that you don't have to be focused. Charlotte, you're saying the University of West Indies in Barbados in biology. Amazing. Okay. Wow. Thank you so much, Charlotte. So this Pomodoro technique, this is not the end of the story. I'm going to show you exactly how to use it. So we just looked at farm, right? I showed you an idea of what it looks like to chunk information. but we're going to be very precise. So when I looked at my book in the previous exam here, I said, okay, I think I'm going to take 3 tomatoes. That means about an hour and a half to look at this chapter. I'm just measuring myself already. I'm trying to give myself a deadline, okay? Because we all do better when we have deadline, right? And then you're trying to just also create something you can stick with. It's like accountability for yourself. And then you say farm quiz, I think it's going to take me 1 hour because I really want to be cautious. I want to check my answer, not just do the quizzes, but check my answer. So that's what's happening. You are actually listing those when you're studying, and you say ceiling review is going to take me 30 minutes, and I need a draft for my resume because some of you have graduated, it seems like. You know, you are going to put the tomato too. And Gianna, you're telling me you use this method. That is amazing. First of all, can you tell me more about when you started using it, or who taught you that, or how you use it? Thank you so much, everybody, for participating. So this is the tomato technique. So again, we are studying in the whole context of how your brain works, how you can maximize your memory. We just talked about how you can look at the big picture, make it digestible, and actually giving yourself a schedule. So those are 2 steps you can do. There's one more thing. There are actually 2 more things that you can do when you are studying to maximize your brain performance. We think of memory as something that is magical, that only some people in this world can do. But you know what? Back in the days, I mean, what do you think people have done in order to memorize things? They didn't have pen and paper. Like, they didn't have phones, obviously. So they had to memorize by using things that are available to them. Well, they were just rely on this. So I'm just telling you, you have the capacity. You're born with that power already. They just told you at age 7 when we went to school, they told you good luck, and nobody taught you how to use your brain. Unfortunately, that's the case. And we're going to change that right now, especially you still have some semesters to go at school. I really want this to work for you. So Maria, there's something called photographic memory, and another session I'll talk about it too, but scientifically, actually, they even say photographic memory does not exist. The people who say they have photographic memory actually are encoding the information very efficiently. That's about it. So the third part I want to talk about when you are trying to maximize your brain power is to add context. There's a study, many studies actually, that shows this. When the participants, so the students were giving a content, they perform about 40% better than the students who were not given a context. So let's say you were just reading, you're just grabbing a book, and you're just reading. Sometimes you're like, why am I reading this? Or what chapter is this? Or how much more do I have to go to? See, if you don't have any of the context, you are not going to perform well, even though you're reading the same thing. This is from a real study, and I continuously listen and learn how to learn so I can teach it. I teach this to faculty members as well. I'm a speaker for educational conferences as well, because I really believe in empowering the faculties as well. Anyhow, when you're reading things like that, you have to be very specific about the context. So here it is. Context is actually really fun. Think about, first of all, when you started to open this pharmacology book, instead of jumping right into it, you look around saying, where are you? Where are you guys when you're studying right now? Anybody is actually going to school for didactic courses, or you're all staying at home for didactic courses and only going to school when you have clinic? Aaron, you say you're learning online right now. Some of you actually, you know what, I can recall some of your names from the emails that I got. I don't have the first and last name, I don't have everything, but thank you very much, everybody who are emailing me with questions. And I always try to follow up as fast as I can. So yes, you all doing it online right now. Okay, so when you're sitting in your home, where are you? Are you in your room? Are you in the kitchen? Are you in the living room? Are you in your backyard? Where are you? What is your favorite place to learn? We can put it on the chat right now. Is that your bedroom? Is that the backyard? I mean, change it up. That's a great idea. Okay, coffee shop. Oh, I miss going to coffee shops. The couch. I love the couch as well. It makes you feel comfortable, right? So when you're looking around, where are you? So you tell yourself right now, well, in my case, I'm in my office. I have my monitor in front of me. I have 3 mugs going on around me. I have like 2 different books next to me. And JC, you live in an Airbnb. Well, thank you for sharing. I hope it's working. Kids working desk. We do what we can, right? So you look at things and then you try to just enhance that a little bit. You have to augment it. You got to sprinkle it. The brain loves sprinkles, such as what funny thing happened to you today? Anything that happened to you that is funny, that is memorable, you can put it on the chat. I'll tell you what I dreamt about last night. I dreamt about seeing or meeting a boy band. Okay, so if you look at me, I'm originally from South Korea. South Korea is the land of, well, there are a few famous boy bands and girl bands, right? Like Blackpink. You guys all know Blackpink? So, you know, something that is memorable. Charlotte, you say you found your credit card in your bra. Wow, okay. Michaela, your dryer broke. Something like that. That is perfect. Something that is memorable. Now you look at pharmacology, you are having fun already. And what day is it? Are we a Tuesday? Okay. Or what did you have for breakfast? Or what's the weather? So I want you to just think about all the context that is surrounding you, because I will tell you, when you need to recall the information, that's exactly what we're going to use, okay? I'm not at that part yet of when you are in the examination, what you can do to maximize your score, but please do that when you are trying to learn. Anybody have had questions on this? You guys can do this, right? If you can do it, say yes. This is an easy step that can benefit everybody, and I'll get to why we're doing this. So again, let's go back. We learn how we learn how to just put some context over here. Before that, we learned how to chunk information using Pomodoro technique. And even before that, we looked at how we can see the big picture. Now, one more thing I want to add, which is the big part of our webinar, is using WakeUp Memory. Now, WakeUp Memory is what I have created with me teaching faculty, students, being a memory champion. It is nothing completely new, guys. I'll be very honest. Like, I didn't invent this per se. It's like our ancestors 5,000 years ago invented it. I didn't, but I'm just repackaging so it works for us in the modern century. So as you saw in the video, there's something called the prefrontal cortex. That is the short-term memory. And then you have what is called the hippocampus. That is going to be the memory processing center. And here, the hippocampus is kind of those little C in the middle area over here. So those are memory processes. What we have to do is try to activate the hippocampus. Then this is what we're going to do. There's only literally one thing you have to do in order to augment, to magnify your memory, is to sandwich what you know and what you don't know. So as you see on the top, you have an information that you know already. And then you're going to put a bunch of things in the middle, something that you don't know. And then you're going to also put it together with something that you already know. You know, guys, anybody have children over here? You can say yes or, yep, okay. So let's take some children example. If they do not want to eat, what do you do sometimes in the context of like sandwiching what you know and what you don't know? Is there a trick that you use? I'll tell you guys, you grind things. Why do you grind things, Maria? Because they can't see it, right? Jennifer, you mix stuff they like. That's exactly what we're doing here. Again, I told you guys, studying is like eating. So they can't pick it up, right? So this is the thing too. Well, by us sandwiching information we know, information we don't know together, While we are mixing stuff, we can't just pull out and say, well, I don't actually want to do that. Hopefully they're glued together. And also, well, we're just mixing it with things that you actually like. So actually the peas taste like applesauce at the same time. So we need to use the same format, because if you're trying to cram something, you don't know. If you're just trying to cram something like the middle area, you know, let's say they don't like peas, and you just trying to give them peas, well, that's going to go well, right? Nobody's going to want it. So this is what I want you to do. Do you get my concept, the sandwich memory concept? Okay. So I'm going to talk a little bit more about that. Any questions on this so far? Are we okay? No, this is good. Okay, guys, ladies and gentlemen, though, tell me, do you understand the sandwich concept? Because I'm going to move into some examples that we have. Perfect. So examples here. Well, let's go back to this question that we had. If you are taking an antiplatelet agent, are you going to give them what? Say if you have pain, because we're going to do some surgery on you today, what are you going to take? I'm going to show you how we should have memorized this using WakeUp Memory. So this is literally a screenshot of StudentRDH, the book that I have. I just thought, okay, I should actually use real examples. So what you have here on the right side, if you have the book, are like kind of memory tricks. I have it all over the book. Sometimes it's in the videos in StudentRDH. This is how we are different than other boards review, because I literally am trying to tell you how to memorize this, or give you things like that, like we're doing today, the concept, so you can apply it anywhere you want. So here you have some memory techniques, but let me jump straight into what you actually had to know in order to solve this problem, okay? So I want you to see acetaminophen. It's right here, right? It is good for antipyretic, meaning fever, pain, but it is not good for anti-inflammatory. What I want you, this is already a memory technique that I created over here, acetaminophen. I want you to just focus on, like, zoom in on this node. Sorry guys, there are fire trucks outside right now. I want you to focus on this no. Like, it's like the word is already telling you no. No for what? Like, it's, I don't want to be helpful for inflammation, so don't take me when you have a sprained ankle. And I'm not going to help you coagulate blood. I'm not going to help you being the glue. So you found a clue, something, okay, that is information, you know. Remember the sandwich method? This is like what you know, saying no. And you have the story at the bottom of something that you can actually digest. In the middle, you put this new information of what acetaminophen is not effective for inflammation, is not effective for coagulation. Okay, in other words, now this is where we have to think a little bit more critically, because dental hygiene is not just about memorization. It's like, once you have memorized it, what you do with that information. So it's not going to help you with coagulation. So here it is. So if you look at some other areas over here, an NSAID can interfere with the blood ability to clot, okay? Therefore, it is contraindicated with blood thinners such as warfarin. And aspirin is also used as an antiplatelet agent. Oh, I think, guys, I'm describing a little in a confusing manner. But anyways, let me continue my story. So obviously, the answer is not aspirin. It is not ibuprofen either. It is not naproxen either. Because if a patient is taking some sort of blood thinner, such as warfarin and Coumadin, which are very, very common. Anybody had a patient who were taking those medications yet? Yes, right? Because maybe were they older? Maybe they had some sort of heart conditions before, right? Okay. So if you are taking, for example, an aspirin, because it is an antiplatelet agent of its own as well, you're going to make the blood super thin, which is not good. That means when there's a cut, it's going to bleed like crazy. So in this case, you want to use a drug that is not going to make you bleed like crazy, and that is this acetaminophen, because it actually has no effect on blood coagulation. The other ones are going to make it even thinner. However, acetaminophen, remember, it's a no, it's not going to do anything for coagulation. So what I'm trying to do again here is find something that I know, put something that I don't know in the middle, and sandwich it so that now my brain can memorize it, can comprehend it. And if we go back to this information, okay, now we know the answer is acetaminophen because you see this big keyword antiplatelet and you say pain medication. So if the patient has an antiplatelet, remember aspirin, it makes it even thinner. Naproxen is making it even thinner. Ibuprofen is making it even thinner. Here we have a no here that is giving us a clue that it is not going to be effective, or it's not going to really do anything related to blood coagulation. So this was just one of an idea, just an example of how you can use memory techniques, the sandwich method. Now there's a time here for giveaway. Anybody want to win an Amazon gift card over here? If you do, very easy, friends. You're just gonna text me. Take out your phone, text 202-410-4202, and one of you is gonna win an Amazon gift card. Just text StudentRDH, okay? And you can take a screenshot of that if you want, because I just have a few more things to tell you for our presentation. Okay. Oh, no, sorry. Oh, I made a mistake. Corrections, 4202. 4202, okay? Do not listen to me. This is a 4202. I made a mistake over here. Typo. All right, so if you have that number down, please text me, and I'm just gonna, by the end, I'm gonna announce a winner already. We're gonna do it right away. Now, this is another example with the hypertension drugs. Atenolol is a D and a D for me because I'm trying to look at something that I already know. I'm going to flip it and I'm going to say beta blocker. IDE, I take the iodine there, I flip it, I said diuretic. Things that end with pril are, well, ACE inhibitors. But how am I going to know that? Instead of cramming it, I'm going to say A like advance of April, and A like, if you have a card deck, like an ACE. So I'm just showing you an example again of how you're trying to take something like, like April, and then your sandwiches with like something you don't know, which is like an ACE inhibitor. And then you get to the final conclusion, things that end with pril or ACE inhibitor. You go to the examination, you know your answer now. So this was just really the concept of being able to use wake-up memory technique. And when you do so, this is what's happening in your brain. You are just, the nerves, okay, they have dendrites. Those are the transmitting information. They are connecting with one another. So this information, the new ones are just really making sense in your brain. And this is a microscopic view of actually you growing your neurons, growing your brain. Okay, so I hope this makes sense to everybody, because this concept, I think if you learn this right now, if you have children, you can actually teach them as well. One more example here of how you're going to sandwich what you don't know and you know. Sometimes it actually takes a bit of an effort, but let me quickly tell you, have you ever heard that, like, heart pumping, left ventricle, right atria, all of that? Like, were you ever confused about like, where's the vein, where's the artery? Who is pumping to what and what is going to happen? I always was confused until I created this for myself to memorize it. Are you guys ready? So the top are atria, the bottoms are ventricle. How do I memorize it? Again, wake up memory. Do you see the bottom is like a V, literally. So the bottom is ventria, the top is atrium. That's it. Okay, let's continue. 4 chambers. We're dividing it into 4 areas. Okay, so like how, where do we send it? You just text me at 202-410-4202. You type in StudentRDH like you were gonna text me. Okay, so the right side and the left side, it's flipped like when we read a radiograph. So this is the right side actually, and this is the left side. Now, what you have to know is where the blood is coming in, and some are blood is coming out. So I'm just going to do it fairly quickly today, but it's in, out, in, out. Okay. So coming in is here, and then coming out, they're here. Well, this is not the end of the story. You know, some atrial ventricle are pumping to the lungs and some are pumping to the body. Okay, we're not going to review full, medical conditions over here, but quickly. This is B, L, mirror image L, B, like a ball if you want, okay? Like a ball. So what it is, let me translate that to you. B, okay, blood from your body are going to come to the right atria, okay? Blood from the lungs, okay, those are the ones that are fresh, okay, that have oxygen, are coming to your heart through the left atria. The heart is going to pump out blood to your entire body through the left ventricle, and your deoxygenated blood are going to come out of the right ventricle to go to the lungs to pick up more oxygen. So this is really a summary of it. And I know if you haven't exactly studied this yet, it can be very confusing. But again, this is an example of how you can use memory techniques. And once you do that, you're going to learn it forever instead of trying to cram right atria. What does right atria? Because when you go to the examination, everything is going to look confusing. Everything is going to look similar. Perfect. Now we have learned what actually you can do when you're preparing for the examination. Let's learn about what you can do during the examination. And we're going towards the end of our presentation. When you are sitting in the examination, anybody like meditate? Anybody take 1 second in order to just think about what you have just learned? Anybody just sit there, Erin, you're doing, that's great. Jennifer, deep breath. Gianna, yes. Makila, yes. Perfect. So friends, do not jump into the examination. You take your moment, you take your sweet time. Nobody can tell you rush. So I'm going to tell you a story, a very quick story of when I was a student. This my pharmacology professor. His name is Dr. Pino, very excellent, amazing person, bright person, PhD in pharmacology. Now he was teaching us, and when he gave us the first exam, okay, not the midterm, but the first, smaller quizzes that you have, you know what I did? I just flipped it. And I closed my eyes for like 5 minutes. And he thought I was either, oh, Erin, oh my God, that's your, Pino, please tell Dr. Pino, this is Claire, or okay, if you guys really want to know my real Korean name, my name is Hayoung. Anyways, you tell him, I mean, he knows me, And he can tell you this story as well, that he thought I was either going to be a genius or I'm going to be the biggest failure because I was not even looking at my exam for 5 minutes. You can ask him about that story, actually. So this is what I did, but what was I doing in that time? Now Pino knows, okay? What was I doing? What it is, I'm just meditating myself. I'm just hypnotizing myself to say, hey, hippocampus, remember, like you did all this work, wake up now. Brain, wake up. That's all I was doing. And I'm going to tell you one more thing that I was doing while I was meditating for 5 minutes. Obviously, by breathing, I'm calming myself down, but that's not the only thing that I do. This is what I do. I try to think, where was I when I was studying pharmacology or hypertension? Was I in my bedroom? Or was I at school? Wait, what was unusual about that day? Remember, Charlotte, I think you shared that credit card in your bra. I mean, that is awesome. That's like, oh yeah, that was the day when I found my credit card in my bra. I mean, how weird. Or that's when the dishwasher broke. What did you say? Dryer or dishwasher? I think you said dryer, actually. Or that's the day was like in my dream, wild about just being with the boy band. That's something unusual, right? So you're waking up parts of the brain. You're like, wake up neurons. And then you think more closely now into, okay, what page was I studying? You visualize it. Where was my anchor? Where was the image? What was something fun about that? when I was studying? What was new about that? And landmarks, I told you, right? You can use some areas in your textbook to be anchors, especially images, chart, they work well. So you can say, on the right top, I saw an image of that bleeding gum, for example. So then on the bottom left, I remember there was something about lidocaine. I'm making this up, right? And you know, you can think, okay, was that in the afternoon, morning? So you literally are going back into where you came from, okay? And Charlotte is saying, even funnier when someone else says it. Well, now this story is stuck in my brain because it's so magnetic. It's so funny. So I want you to just, when you close your eyes, you breathe in and out. Okay, we can all do that. But at the same time, I want you to do this exercise. You go in that room, you visualize where you were. So this is the answer to why do I even have to understand my context? Why do I even have to tell myself stories like that? Because when you are sitting in the examination, that's how you're gonna wake up your brain. You're not gonna go there in a dull state, being confused with everything that happened to you in your life and going to Starbucks and someone wrote your name incorrectly and spilling the coffee. No, you're focusing on the moment because your brain has a special place for visual. So actually looking at your textbook, so you're seeing in your brain now. Your memory has a special area for places like surrounding. So if you can see your surrounding in your brain's eye, you are there again, seeing your textbook again. Let me show you. This is Sherlock Holmes. Do you guys know Sherlock Holmes? Have you ever seen that show before? So I just want you to just quickly look at this.
Something buried deep. Get out. What? Get out. I need to go to my mind palace. The what?
I'm going to fast forward this here. All right. So what I was trying to get to is, you know, those moments when he was like, oh, I see like, you know, this logo from the hotel. I mean, this is Sherlock Holmes. I'm like, oh, I see this like face, you know. What he was doing is just going back to what his brain has encoded already. And what was that? Oh, just like Sean from the Doctors. Is that a show, Maria? I'm not really sure what that show is, but basically that is the concept. So that's really how you can maximize your brain power when you're sitting in the examination. And I don't really think anybody has told you this or taught you that, but and that this might sound crazy, right? It might sound like, correct, Claire, you're a little crazy while you're teaching us things like that. I thought I was coming to the webinar to learn about how to use my notes. But you know, those are the things that nobody is teaching you that really makes a difference. And people are a little ashamed of using things like that because it sounds a little bit like kindergarten sometimes when you do this. However, know that that's originally how a brain was designed. We love visual, we love thinking about places. So if you can understand how you can maximize your power, I feel like you're going to feel a lot more confident when you go to any examination. If you are first year student, second year student, until the day you don't have to take an examination, until the day you don't have to study, which is never, because you're going to continue your education when you're hygienist, right? You're gonna just love this. Okay, so thank you very much for being here with me today at the webinar. And Shadu is saying, I do the same thing. You stare and you look into the space. That is amazing. So, and Maria, you're drawing things. Why are you drawing things? Because when you draw things, you are creating landmarks. Remember what I told you about landmarks? You're creating yourself some areas that you can focus and you can remember. And there's a special place, I told you again, about spacing, meaning when you draw, you're using your hands, you're using space. So that was that, friends. I am here not to sell you StudentRDH, just to tell you to go to free trial. If you have questions, you know, I'm always here. My name is Claire again. You can find me at clairej@studentrdh.com. I did record it. I started kind of a little bit, maybe 10 minutes into it, but I have recorded it as well. I know we are Tuesday. Thank you so much for being here in your classroom time, maybe, or maybe you just had a break time. Just trying to use your valuable time with me is awesome. Now, one more chance, everybody, to enter this giveaway, because in 1 minute, I'm going to announce the winner. Again, you go to this phone number and you are going to type what you think, StudentRDH, and I'm just going to pick one winner. I do not know who is in this webinar today, okay? In the text message. I just see, as you can see, just since someone texted me, I just need to understand how I'm just going to pick it. Probably just close my eyes and do it. And one last thing, friends, and if that's okay, I would love to call you all friends. We're here, you know, kind of me being StudentRDH, you being the student, but at the end of the day, you're all going to graduate, you're all going to be successful hygienists. I would love to meet you all. I would love to be able to just shake your hand and really just being able to talk about other things than the board examination. So again, one more thing, just enter. So I'm going to do a giveaway right now. While we do that, you guys want to turn on your camera? I just want to take a quick selfie for all of us. Anybody is going to turn on the, thank you very much. Now I can see your faces. That's really nice that you turn off the camera while we're doing this though. Your friends are ready. Let's see. Yes, you were ready? 1, 2, 3. One more time. Let's make sure we all look good, okay? Okay. Thank you, everyone. Okay, here is the giveaway time. Right here, do we have again, I do not know who entered, okay? I just see that someone entered. There's so many of you today. I hear my finger pressed on a. Brianna, do we have a Brianna from Remington College? I feel like you are here. You have to tell Brianna. Yes, awesome. Well, congratulations, Brianna. You are the winner of the Amazon gift card. Yay. Well, thank you again for being here. And if you need anything from me, you know how to find me. I hope some of the things we talked about today were helpful. I'm going to make another series, okay? Because I really feel like we scratched just the surface of our brain. I would love to make one about how to make notes. Because notes is a whole category. It's a whole new system that I want to teach as well. So stay tuned on those emails. If your friends have not yet subscribed to the free emails or the free things that I do at StudentRDH, please tell them to register. And I would love to continue just providing as much information as I can. The series that I do right now are free. Some are only for StudentRDH Success Package members, but a lot of them are free. So again, invite your friends, and thank you. If you have questions, I will always be available, and have a great day.